This is an example scenario of a practical assessment. We have a patient, we have the prospective member, and then we have all the splinting supplies. All right, your scenario. While working at the Student Union Ballroom, an Amherst police officer informs you of a potential assault victim outside. Police are on the scene when you walk over to the northeast entrance of the Student Union Ballroom with your partner to find a 25-year-old patient lying supine on the ground with a knife in their abdomen, screaming for help. You may begin.
All right, BSI scene safety. Is my scene safe?
Yep,
Okay, this looks like it's my only patient.
that's true.
Our fire, police, and ALS on the scene are on the way.
Yes, they are on the way.
Okay, I'm gonna direct my partner to take manual C-spine stabilization.
Got it.
So general impression, this looks to be 25-year-old college-age male who's been stabbed in the abdomen.
Yep.
All right. Hi, my name's Anna. I'm one of the EMTs. Does my patient respond verbally?
Yes, you do get a verbal response.
Okay. I'm now going to perform a blood sweep from head to toe, checking for any major life-threatening injuries.
There's no apparent life threats, but there is an impaled foreign object in the abdomen.
Okay. Okay, now I'm going to assess my patient's airway by using a jaw thrust maneuver. Is the patient's airway open and patent?
Yes, it is.
Okay. Because my patient's responsive to verbal stimuli, I'm not going to consider using an OPA or an NPA. Now I'm going to assess my patient's breathing for rate, rhythm, and quality.
Yep, breathing is present and regular, but ventilations are abnormal in rhythm and shallow.
Okay, I'm now going to inspect the patient's chest cavity, listen to lung sounds. Do I note
Nothing
any
to
injury?
note.
Okay. All right. I'm now going to direct my partner to place the patient on BVM at 15 liters per minute for positive pressure ventilation.
How many breaths per minute?
12 to 20 breaths
All
per
right,
minute.
sounds great.
I'm now going to assess my patient's circulation by checking their radial pulse.
Pulse is present but weak bilaterally in the wrists.
Okay, and I'm now going to assess my patient's skin color, temperature, and condition.
It's cool, pale, and clammy.
Okay, at this time, I'm rechecking my patient for any external hemorrhaging.
The only thing there is bleeding from the stab wound to the abdomen.
Okay, is it spurting or is it a slow pool?
It's a slow pool.
Okay, all right, I'm gonna note that. And I'm gonna treat my patient for shock therapies by keeping them warm.
Okay.
And I'm gonna load and go my patient and request for ALS. This is a priority 1 transport to the nearest appropriate facility.
Sounds go.
Okay, I'm now going to obtain a set of vitals for my patient. Could I get my patient's blood pressure, respiratory rate, heart rate, O2 sat, and blood sugar?
Yes, okay. So your blood pressure is 140 over 118.
Okay.
Your pulse is 58 BPM.
Okay.
Your respiration rate is 28 breaths per minute without intervention, but since you've already given the BVM, it's controlled. It's at the rate that you set your partner to go to. SpO2 is going to be at 100% following your administration of oxygen, and lung sounds are normal, and blood glucose is 82.
Okay, noted. I'm now going to obtain a sample history if possible.
What does sample stand for?
Sample stands for signs and symptoms, allergies, medications, pertinent medical history, last oral intake, and events leading up.
Okay, sounds great. What are the signs?
Well, I see that my patient has a stab wound to the abdomen. Does the patient have any allergies?
Patient has an allergy to ibuprofen.
Okay. Is my patient able to relay any medications?
They don't take any, they say.
Okay. Does the patient have any pertinent medical history?
None reported.
Okay. What's the last thing my patient ate?
A blizzard from Dairy Queen.
And what happened prior to my arrival leading up to the stabbing?
It's unclear, but the patient was likely walking up to the Student Union Ballroom.
Okay. I'm going to look for any like Dexcoms or medical alert jewelry.
Nothing present.
Okay. I'm going to begin my secondary assessment, checking the patient's head, back of the head, orbits, nasal cavity, airway,
What are you checking for?
decap ETLS.
What does that stand for?
Deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, and swelling. I'm now, do I know any of that?
Do you know any of that? The head and scalp are unremarkable. Right eye has visible contusion.
How do the pupils look?
Pupils are pearl.
Okay, anything noted in the ears?
Nothing noted.
Okay, what about the nasal cavity, oral cavity?
Nothing there.
Okay, I'm now going to assess the anterior of the neck, looking for any JVD or tracheal deviation.
Trachea is midline and there's no JVD.
Okay, now I'm going to assess the posterior of the neck, looking for any step-offs.
Nothing noted.
Okay, I'm also going to check the shoulders.
No decapitatus there.
Okay, at this time I'm going to size and fit a C-collar.
How do you properly size up and apply it?
So I'm going to measure from the bottom of the patient's jaw to the patient's collarbone with
Yeah.
my hands. If I had, I'm going to have my imaginary partner continue up to this point and remain holding C-spine
Yeah.
as I am applying this.
Okay. Can you show me how you'd apply it?
Yes.
All right.
Sorry, my nails are making it hard. This patient's a no neck.
Got it. Okay. There you go.
Okay, all right. So my patient would still be holding C-spine or
Yep.
manual, or my partner.
Yeah.
Manually holding C-spine stabilization. All right.
Alrighty. Good.
I'm gonna take it off. Just
Okay.
Comfortably. I'm now gonna check my patient's thoracic cavity for any DCAT VTLS. Do I know any?
You don't know any.
Okay, I'm now going to carefully palpate the patient's abdomen around the penetrating object,
Yep.
checking for any guarding, tenderness, rigidity.
What you find is a penetrating abdominal injury to the left lower quadrant, slow, oozing dark red blood coming from the wound. Knife in the abdomen is approximately 4 inches deep. In terms of guarding, anything like that, nothing of note.
Okay, I'm next gonna assess the patient's pelvis for any crepitus by
Yep.
pushing in and down.
Yep, nothing noted. Pelvis is stable.
Okay, I'm next gonna assess the patient's genitalia for any priapism.
None found.
Okay, I'm then gonna start by assessing the patient's left lower extremity.
All right.
Do I note anything?
You note minor abrasions.
Okay, I'm gonna assess the pedal pulse.
Yep, present.
Okay, and all other CSMs are present.
Yes. Can you verbalize what you do for the other CSMs?
Yes. So I would assess circulation by checking for the pedal pulse.
Yep.
I would assess sensory by asking the patient if they can feel me touching their toe.
All right.
And I would ask the patient to wiggle their toes
Yep.
if they're able to.
Sounds great.
I'm going to repeat that for the other lower extremity.
You find the exact same thing.
Okay,
Abrasions,
intact.
CSMs intact.
Okay, I'm next going to assess the upper extremities, starting with the right upper extremity.
Yep. There's a deformity noted on the right humerus proximal to the elbow.
Okay, are the patient's CSMs intact?
Yes, on both sides.
Okay, I'm also going to assess the other arm.
There's minor abrasions present on the left hand.
Okay, sounds good. At this time, I am going to, the stab wound is to the left or the right abdomen?
It's to the left.
It's to the left of the abdomen?
Yeah.
Okay, so at this time, I'm going to log roll the patient. It's on the left?
Yep.
Oh, I'm gonna log roll the patient onto their right side.
Yep.
With my partner helping.
Yep.
And assess the back of their head for any DCAT VTLS.
Nothing there.
Assess the back of their neck for any step off and down their cervical spine.
Nothing noted.
Assess the buttocks and back of the legs.
Nothing noted.
Okay, I'm now gonna, with my partner, log roll a patient back onto his spine, backboard.
Yep.
Let me log roll back. Okay. I'm now going to manage and treat the wounds appropriately. So I'm first going to secure and stabilize the penetrating object in place with either cling wrap or bulky dressing.
Alrighty.
And I'm also going to treat the injury proximal to the elbow with the sling, or not with the sling, with the splint. So
Alrighty. Can you show me how you would splint?
yes. So again, I'm going to assess for CSMs.
They are present.
Okay, I'm going to instruct my partner to hold manual C-spine stabilization, not C-spine, sorry, manual joint stabilization. Okay. Sorry. The injury is proximal to the elbow, so
Yep.
Is it closed or open?
It is closed.
Okay. I'm gonna have my partner hold this. I would have them hold
Okay.
that.
For the scenario, Merv, you can hold the.
Will you hold that there?
Yeah.
Thank you. I'm then going to apply padded board splint, making sure the padded side is touching the patient.
Yep.
And I'm going to secure below
Yep.
the injury, and then also, and I'm going to also secure above the deformity appropriately. At this time, I'm now going to recheck CSMs.
They're intact.
Okay, due to my patient being supine and on a backboard, I'm going to appropriately secure the injured and splinted extremity to the side of the backboard with a cravat.
Okay. Sounds good.
At this time, I'm going to reassess all my interventions and reassess patient vitals every 5 minutes. And once at the nearest appropriate facility, transfer over patient care appropriately.
Sounds great. Congratulations, you passed.
Yay!